Hey all, Dr. Adam here with another edition of Make a Difference Monday. So today I wanted to dive into and cover the wrist. I have patients come in to me all the time, into our office saying that, their wrist hurts or they have pain, radiating from their neck down to their hand. They say, Doc, I got carpal tunnel. What's going on here? So let's break this down. So with the wrist, there are approximately 27 bones in the hand, right? In the hand completely. Now, carpal tunnel syndrome should be called carpal flat syndrome. So there's normally a nice archway for the median nerve to flow through here, but through repetitive use, injuries, other things, those carpal bones can flatten out and push forward. Now, with us being a chiropractic office, what we focus on too, and I got this poster here, is the nerve supply from its origin in your spine all the way down and out into the hands. So this area right here is called the brachial plexus. That is the area of the lower part of your neck where the nerves exit and go down to your shoulders and hands. So if that nerve is getting pinched or cut off in your neck, by the time it gets all the way down to the wrist, it's going to be severely impacted. So that's where we look first, right? Making sure that the neck is clear, remove the subluxations of the neck, allow the nerves to flow properly and your body to heal properly. Now, if there's still carpal tunnel-like symptoms down into the wrist, we can look into the shoulder, look into the elbow, and then all the way into the wrist itself. So there are, a row of bones in your hand, like I was talking about earlier. The lunate bone specifically goes right in the center or is the keystone to the arch of the carpal tunnel, right? So if that bone, again, is smashed and pressing forward, it's going to be pushing on the median nerve. There's also the bone right under the thumb, the scaphoid, that can also become subluxated and needs adjusted there. But now, now that you're all adjusted, this is hands down the best exercise for the wrists themselves. So you can I have 2 rubber bands here. You can start with one and go right along where the fingernail meets the skin and, do some extension. So rarely do we ever extend our hands against resistance. We're usually grab, or grabbing onto a mouse, repetitive motion. It could be your job. It could be, lifestyle habits, certain things that can cause pain in the wrist. I've even had a video game player tell me about this. So I do 50 of these on each hand before I go to the office every day because I have an old rugby injury. Try and keep the hand strong. So starting off with 20 repetitions is a good starting point, and you can feel that spot in your forearm. It gets really tight and sore, and take your hand and kind of rub through that to break up some of those scar tissues and adhesions. Now, great and protective for the wrist here, getting it strong, getting good grip strength. Now for the thumb and the pinky, you can also isolate. I'm going to drop down to 1 rubber band and really isolate just my pinky and thumb. So the thumb goes in many different planes and ranges of motion. And, the whole point to all these hand exercises is to keep your hands strong so that when you're 100 years old, you can deal cards, right? Knit, sew, do the fine motor skills that you want to be doing so you can get the most out of life. So, if you have any wrist pain or soreness, bring it up to your doctor of chiropractic and have a great day.